Dr. Steve Nissen is chairman of cardiology at the Cleveland Clinic. Dr. Nissen, how surprised were you when you got word that Zetia might actually do more harm than good?
Well, this was just a stunning result. We had always assumed that adding a second drug to lower cholesterol would have an incremental benefit over, the traditional statin medications that we use so widely. In all historical studies, the more you lowered cholesterol, the better the outcome. In this case, it simply didn't work. Adding Zetia to Zocor, which is what makes the drug Vytorin, had no benefits whatsoever at slowing the progression of plaque buildup in the carotid arteries in the neck.
In fact, it actually increased the amount of plaque, did it not?
Well, the differences were not statistically significant, but the trend was going in the wrong direction. In addition, there were actually a few more cardiovascular events, heart attacks and strokes. So we see no evidence of any benefit of this very heavily advertised, very widely used cholesterol medication, Vytorin.
The results of this study had been delayed more than once. The companies Merck and Schering-Plough missed several deadlines that they had imposed themselves. Do you think this was an effort to keep this information away from consumers?
Well, of course, no one will know. As I think you know, there is a congressional investigation ongoing. Congress has said they will get to the bottom of this. I feel strongly that it's very important that practicing physicians and the public be informed about the results of drug trials, whether they be good or bad. We can only make good decisions for our patients when we have the totality of information about drug effects, whether they're good effects or bad effects.
So what would you advise people who are taking Zetia either on its own or in conjunction with another statin?
Well, patients should always talk to their doctor. No one should ever stop taking a medication because they hear a news report. What they should do, however, is have a very thoughtful discussion with their physicians. My advice to physicians is not to use this drug, Vytorin, nor to use Zetia as first-line agents anymore. These should be really relegated to drugs of last resort until we have some evidence that they produce a health outcomes benefit. Right now, 5 years into this, with nearly 1 million prescriptions per week being written, there's no evidence that the drugs actually produce any benefit for patients.
A recent study showed that cholesterol levels in this country were at an all-time low, thanks largely to statins and these kinds of medications. But do you think that is giving users a false sense of security because it's being treated as a magic bullet, if you will?
Well, we have to find the right way to lower cholesterol. We know that lowering cholesterol with statins is highly effective at preventing heart attacks and strokes. We had hoped that lowering cholesterol using a drug like Zetia on top of a statin would also be effective. We found out today that it doesn't appear to work. It may not be the end of the story, but at least for the moment, I think we've got to stick with what we know works, and that's the statin drugs.
So you have no hesitation about recommending statins to people for lowering of cholesterol, even if they don't follow a healthy lifestyle?
Well, it's really a partnership. We always ask our patients to follow a healthy lifestyle. No drug is a substitute for doing the right things, exercising and eating a healthy diet. That's always good advice. But for a lot of people, even with a healthy diet and exercise, cholesterol levels are very high. And for those people, when they have sufficient risk, we give statin drugs. We have to stick with statin drugs, and patients need to stick with them. And if they stick with them for the long term, they will reduce their risk of heart attack and stroke.